YouTube channel, which we call knurs.com. Today I'm here talking about nursing process, really, in nursing. Well, when they are trying to talk about nursing process, it is a systematic manner of caring for client problem through assessment, diagnosis, planning, intervention in order to achieve your goal, meaning the patient's well-being. That is what we mean about nursing process. And under this nursing process, we have 5 pillars. We call it components. We call it components. Out of these components, we have what we call abbreviation. The abbreviation is what we call ADPI. 1, 2, 3, 4, 5. This is the abbreviation we can use in order to remember the components of nursing process. Now let us talk about assessment. When they are trying to talk about assessment, it is the first component of nursing process, which we call assessment. The assessment involves history taking, physical examination, and lab investigation. These are the 3 things that you can do under assessment. But before knowing this, let us try to know the definition. It is the first stages of nursing process in which investigation or information have to be collected, or data, in order for interpretations and analysis, so that you can meet your holistic goal. This means that the assessment, it is the collection of data in order for analysis, interpretation, organization, so that you can achieve your second goal. That is what we talk about the assessment. Now, under this assessment, we talk about data collection. Data collection. Data collection. Under data collection, it is the process of collecting information concerning about that particular patient. But under this data, we have 2 types of data in which you have to know. 2 types of data. 2 types of data. We have objective data, objective data, objective data, and subjective data. Subjective data. The objective data mainly trying to talk about what you are going to find on the patient. The patient is not going to tell you, but what the patient is going to tell you are going to find on the patient with yourself is what we call objective data. For instance, physical examination. Physical examination, lab investigation is part of objective data. Vital sign taking, you are going to see for yourself. That is what you call objective data. But for the subjective data, it is a situation wherein what the patient is going to tell you about his or her hospitals. For instance, history taking. History taking. And under this subjective data, which we call history taking, we have so many types of history: present and past medical history, the social history, nutritional history, genetic history, family history. These are all types of history that will fall under subjective data, because the patient is going to tell you before you are going to know, either the patient or the relative. So that is what we call objective data. Now let us go to what we call as the second, which we call diagnosis. Diagnosis as the second component. The diagnosis, it is the information you collected through the assessment in order to identify the possible problem the client is suffering from. And under this diagnosis, we are trying to talk about 2 things. We have what we call actual diagnosis and potential diagnosis. Potential. So the actual diagnosis simply trying to talk about what is the life-threatening condition the patient is about. For instance, patient with respiratory distress. You cannot compare it to someone in pain. So you are going to collect first the respiratory distress before going to pain, based on priority or Abraham Maslow's hierarchies of need. So that is what you are going to do. The actual is trying to deal with life-threatening condition. Life-threatening condition. This one is the potential is what you suspect will occur in future if you don't collect it. For instance, if you know that patient is bedridden and then that patient you don't pass catheter or you are not frequently position the patient, that one is potential that the patient is going to fall what you call pressure ulcer. So that one is potential diagnosis. But all the ABC, the airway, breathing, circulation are mostly fall under life-threatening condition. That one should be your actual diagnosis. Now, under this diagnosis, there are ways we can diagnose these patients after collection of data, analysis, interpretation through assessment. Let us go to the diagnosis, nursing diagnosis. So the nursing diagnosis, first you are going to look at the problem and related causes, and also the manifestation. These are the three things involved in nursing diagnosis. The problem, you are going to get it from NANDA. NANDA means Northern American Nursing Diagnosis Association. Then the related problem is the pathology or what is causing the problem, the causing of the problem. And this one is the signs and symptoms. Signs and symptoms. So the signs and symptoms normally fall under the manifestation. What we prove this. So if you have something like this, it's what you call the nursing diagnosis. For instance, someone is having respiratory distress. The ineffective breathing pattern is the problem from NANDA. Like if there is obstruction in the airway or due to the accumulation of fluid in the lungs, accumulation related to what? Accumulation of fluids in the lungs, or decrease lung tissue, or death of lung tissue, as manifested by respiratory distress, either 30 breaths per minute in adults, is what we call as NANDA. That is the nursing diagnosis that you are going to give. So in the next video, I will talk about the planning and intervention. Thank you, the viewer.